With support from international partners, the Bono East Regional Directorate of Health Services has kick-started the round 1 of the National Polio Vaccination Campaign, which aims at preventing polio transmission by ensuring that every child under the age of 5 receives a polio vaccine. The move, according to the Regional Director of Health Services, Dr. Paulina Clara Pia, is to help ensure that no child is left behind in the fight against polio by helping boost their immunity.
The purpose of this polio campaign is to be able to respond to an event of polio in the country. Somewhere in September, in Eastern Region, polio was detected there in the environment. And one of the things that we need to know is that when you have polio in the environment, it means that somebody is shedding the polio virus in the environment, and which can easily be transmitted to other children. And so what we are doing is to be able to boost the immunity of our children and to prevent them from anybody from getting the paralysis.
The region, with a target of immunizing over 240,000 children, is also working towards improving its surveillance across the various communities, and hence parents and caregivers are being encouraged to cooperate with the house-to-house health staff as a means of helping prevent outbreaks of the disease.
The other thing too is that we are also using this opportunity to be able to improve the surveillance of polio. And so what we are doing is that any community that we will go into, we will also ask the community members whether they've seen any child who is less than 15 years who has any sudden onset of paralysis. And if you're able to see some, we also go and investigate and see whether it is polio that is causing that one. And then what we also do is to be able to prevent outbreaks, prevent any child to actually get the paralysis.
Dr. Paulina Clara Pia was, however, quick to admonish parents to take their routine vaccination exercises seriously to help prevent children from having vaccine-preventable diseases.
To be able to sustain the gains, is to be able to strengthen our routine vaccination. So we are saying that from this campaign, when it's time for vaccination, mothers or parents should send their child for the routine vaccinations. Then they will get the polio vaccine, but then also get the other vaccines that will prevent other childhood vaccines that will prevent the children from having vaccine preventable disease.
Adam Ahudu Lukman is the EPR coordinator for Kintampo North and is responsible for the management and coordination of emergency preparedness and response activities. He says enough arrangements has been made to ensure that all children are captured, particularly those in schools.
The teams are moving from house to house. But now, as we've started, we are trying to clear all the schools because that's where you can get the majority of the children. From there, we now move target the houses, and then from there, I think we'll be done for the exercise, and then we'll prepare adequately for the next round.
Reporting for Joy News, Anas Sabit, Kintampo.